Yeah, we are live now.
Yeah, okay. Can you see my picture? Yes. Yeah.
All right. Okay.
Okay.
Good evening, ladies and gentlemen, who have joined us on this Dr. Fundi platform. My name is Dr. Fundi Lenyati, the host of this channel. Today, we have another special guest as part of our Mbogodo conversations, which we started at the beginning of the month. Our special guest today is Dr. Zanele Sithebe. She is a specialist anesthetist or anesthesiologist who is in private practice operating from RV Hospital in Kempton Park. She also does sessions in the public sector hospitals, specifically Tambo Memorial Hospital. Now, I just want to take you through the journey that she had to navigate for her to fulfill her dream as a doctor. All right. She first did her BSc degree with University of Durban, Westville. And then she went on to do BSc honors in physiology at the Durban, Westville. And she went on to do masters in physiology. After the first year, she got admitted to do medicine. So she never finished her master's degree because she got an opportunity to do medicine at Medunsa. She then did have, medicine at Medunsa and qualified as a doctor in 2001. Nowadays, Medunsa is referred to as Sefako Makgato University of Health Sciences. So she's been a doctor for the last 19 years. Right, but she did not get satisfied with just having an MPCHP degree. She then decided, after doing internship and community service, that she's going to study further. She had an interest in the field of medicine that is called anesthetics. So she got a diploma in anesthetics in 2004. And I think it gave her a taste of that area of discipline that we call anesthesia. And she went on to then specialize in anesthesia from 2005 up until 2009. And then she became a specialist in anesthesia or anesthesiology in 2011. But she still was not done. She decided to do a 6 months in critical care at Steve Biko Academic Hospital in Pretoria. So I present to you Dr. Zanele Sithebe. Doc, welcome.
Good evening, everyone. Good evening, Dr. Fundi. Thank you very much for this opportunity. I think it's very important that we share our stories because people see us when we are up there and they think it's only for special people. So today I'm here to tell you that it's possible for anyone to achieve and be where I am. Just it's hard work. It's hard work.
Doc, I mean, when I look at the number of years of you being a student post-matric, there was the first 3 years of the BSc, a 4th year of honors in BSc, a first year of the masters. That's like 5 years at UTW. And then you went and did medicine for another 5 years at Medunsa. That's 10 years of study. You did your ComServe, your internship, and then you committed yourself to another more than 5 years of studying. I mean, what is it about you and studying?
You know what? You actually, the number of years that you are counting are actually even this. Because my BSc degree, it took me 5 years.
Wow. Okay. All right.
Yes, because So what happened is that after finishing my matric, I then I need to start from
I think Doc, let's do it this way. Let's not start in the middle. Let's start from Edandi, where you were born, right? A KZN, a Vasbank. Let's start there. You come from Vasbank in Dandi, KZN. That's like Midlands, or is it Midlands? Or yeah, that should be Midlands. Yeah, let's start there. That's where you come from. What kind of a place is Vasbank?
It's a village. It's a village. Well, we initially lived in a village which is about 60 kilometers from Ladysmith. We used to identify with Ladysmith more, but later we identify more with Dundee. You know?
Yeah.
So it's just a village where initially people were fetching water from the dams. Where there was no electricity. There's still gravel roads. It's as rural as you can think, but I was fortunate enough that my dad was an entrepreneur. So he had businesses, he had stuff. So even though I lived in the village, but at least my household was well off. I had electricity, we had a tank, we had things, but things like phones were still not accessible in that area. So I'm a fourth child.
Doc, I want you to relax. I want you to relax. Yeah, I want you to relax. Right? I mean, you sent me your CV, and in your CV, there's a few things that you highlight. The first one is that you come from a family where you are the fourth child out of 8 children, right? From your mom.
Well, to correct you, yes, okay.
From your mom.
Yes,
but your dad had 2 wives. All right.
Yes.
And you say here 20 kids at least. I was very interested with that at least. More than the 20, you know. So I was challenging, you know, where you grew up with so many people in a polygamous situation. How was it growing up there?
Well, our family was full of love. My parents. So okay, the second wife came much later on in my life when I was already at varsity. But we're 14 kids staying in one home, and my dad and my mom, all the extended families, anyone in our family, because we were always the well-off in the entire family. So we had uncles that came and lived with us and went to school and stuff like that. So it was a nice, big family where we had a lot of love, but our parents were hardworking. What really propelled me to get to the point where I am is that my mom and my dad were slave drivers. They were hardworking.
You mentioned that your dad had, he was a businessman. He had grocery shops, not shop, shops.
Yes, he did.
So tell us about this man.
Yes. My dad is a very, very wise, very, very strong man who never even went to school, not even like sub A or sub B like that. But the way that man is wise, it's unbelievable. He initially, they were living in a farm, and then apparently at some age they would put you out of school and force your child to go and work the fields. So he ran away from his parents' house to come to Joburg and work in Joburg. So when he got to Joburg, he's very good in terms of saving money. So he started small jobs, and then he was made a chief, sort of someone who is in charge of whatever he was doing. And from there, he started being mashonisa. So he was saving money. So when he saved enough, then he decided, I have enough money. He went back to the village where he started with his first shop.
Yeah.
So his first shop, the first shop he did it when he was still in Joburg. My mom was running it. We were running it from the household, like you know, the usual shops that you have in the village. Yes. So we ran that. So when he thought that was sustainable, that he had enough clientele, then he resigned from his job in Joburg, and then he came down to the village, and then he started building his first shop. Yeah. Then he had his first shop. it became very successful. Then he had another, so he went from this one grocery shop, then he built what do you call it, a wholesaler. People from KZN, Wash Bank, everybody knows Mr. Sithebe. He's the most famous, most known man in the area for his entrepreneurial skills, because whatever he touched turned into gold. So now he had this wholesale shop. Okay, so now all the other shop owners, now instead of going to town, which was 60 kilometers away, Ladysmith is about 60, and then Dundee maybe is about 50, 55. So now they started buying from him. Then he grew even bigger, and then he identified a spot called, in a file somewhere called Emakameni, where there is a taxi rank, and then there he made a grocery store. Then that grocery store was the busiest for the longest time. So yeah, I'm a product of that.
So basically, you had no option but to actually get influenced in terms of entrepreneurial ventures. You guys, did you have to work in these businesses?
Yes. All school holidays for us, unlike other children that will go to visit in the city, we were forced. Initially we used to work the fields. June, July, 5 a.m. they come and they pull your blankets, and you are forced to go work the fields. As the shops, as it got busier with the businesses, then now we're forced to work in the shops. It was not an option. Everybody got up in the morning. We even had a name for him, because each and every time when he comes home, he wanted to see you either working at the shop, because the initial shop was in the same premises with the main house. Yeah, where we stayed. Yeah. So everybody he had to find you busy doing something, because he didn't understand the concept of a child that sits and does nothing. When you come back from school, he very impressed. He emphasized education. You are either doing your schoolwork or you are working. So that's the language you knew.
Okay. Now we've heard about Ubaba. I can see your mom. How was your mom? How was your mom? Because I want to ask you after this, who of the two influenced you most, or they both influenced you in different ways? Yeah.
They were the same. My mom, because now as the businesses were expanding, so my mom had to take care of one of the businesses. My mom was one of the most strongest people that I know. She was brave. There was a time where they were not allowing us to sell alcohol. So, and then in the area where we live, we had a chief. So there was a beef going on between the chief and the alcohol sale and my family and stuff like that. So at some point, the chief sent people to destroy our shop and take everything. My mom stand in front of all these men. He opened a shop. He said, if you come into the shop, I will leave the shop and unlock the shop and burn it down. No, you are not going to come here. We work very hard for this stuff. You guys are not going to come in and take your stuff. She was even more brave than my dad.
So umama ebenguphuma usilwe uyazi mawuthiwa umuntu uphuma silwe.
No bengaphuma silwe bewumuntu obelieve ukuthi you know what, I work hard for this. You have no right to come and take what I have worked hard for. But he was the most loving mother. That sometimes, like I said, that a lot of people of our relatives came and stayed with us for years. We will even be jealous of how much he would love the other kids. We always used to complain that she loved other kids more than us. She was the mother of the community.
Yes. So now you had this mom, very courageous, hardworking, and the dad, very entrepreneurial, hardworking. So besides hard work and obviously, entrepreneurial, influences, what would you say are the things Fundile, from your mom and from your dad, which today actually still apply? You use those things now, man.
Okay. Honesty. It was perseverance, integrity, honesty in all their dealings. They used to tell you, don't ever rob your customers. If you buy something, put a little bit of markup. they always used to tell us these stories about how people, when you don't do things the right way, you're never successful. Like if you know, we're a family of more than 20, but none of our brothers, like you will hear that they've been robbing people and stuff like that, because it was something that was emphasized from the early age, that you need to work hard for your things, integrity, honesty, all those things. So
what about
and work ethic as well.
Yeah, humility. Was about Makaya, they tend to have a lot of humility. Did you guys have humility? I mean, if there was humility, or many abantwana baseshop ndinibhekele phansi abanye abantu?
No. None of my siblings are like that, because my dad will attend every single event in the village, be it a funeral, be it anything. I'm sure the COVID is the reason now he's not attending. My dad, it doesn't matter who you are. He never stratified people. A human being was just a human being. My mom was the same. So I think all of us, we are that when we got that from them.
Okay, lovely. All right, Sisi, let's move on. So what did you want to be, Maukula? Just looking at schooling now, from primary and up to matric. What did you want to be, Mauketa?
All right. What I identified early on is that, Zwelo, I'm very empathetic. I love people. So I knew from the word go that I wanted to do something that will impact on people's lives. Initially, I used to hate to hear stories about how people are poor, how children don't have parents and stuff. So I wanted to be a social worker. So initially, for the longest time, I thought I'd be a social worker. After some time, I realized that I like healthcare. Then I thought, because in our schools, no one has ever even got C aggregate. So I knew medicine was out of reach. So I thought I'll do nursing and become I'll do a nursing then and become a nursing tutor.
Yeah. So that's what you wanted to do. So yes. At what point did you then change? Because I mean, there you were, you passed your matric from Sekusile High School, Emadadin, in Newcastle, right? At the time when the matric Lapeana, were you still thinking about being a nurse, or now you had decided that no, actually I want to do something different?
No, I was thinking about being a nurse even then. I thought I'd still be a nurse.
All right, and so then you applied to UTW, all right? But how are your results? How are your results? I think let's Masbuelela.
Sure. My aggregate was like E. I got E average, EM. Like most of my subjects were in standard grade.
Yes. How? Why was it like that? I thought, I mean, you came from this family at Fundi. So what happened? Was it maybe quality teachers, or what was the issue?
Well, it was a combination of two things. It was the quality of teachers, because even the best student in the school, because I moved to a township where the education was better, Emadadin, because I'm from Washbank. So
Yeah. Can you please switch on your camera, Doc? Doc Zanele? All right. Apologies for that break. All right. Yeah, you are back with us. I was starting to be worried. But Doc, you were still telling us about you moved from the rural area to a township which offered slightly better quality of education.
Yes, but so I was saying is two things. The first thing is that the quality of the education at the time, because even the best of students, they will get like a best student will get D, average of D in the school. Yeah. And then, but for me, what made it worse is that I skipped classes. I skipped from grade 5, I went to grade 7. Okay, that was official. So because I was doing so well, they made me skip from grade 5 to grade 7.
Yeah, let's explain to people. The born frees don't understand the concept of skipping classes, so those days, you were too smart. The principal or the class teacher would recommend that you skip a class and go to the other one. It was something that was common those days. All right. So tell us about that experience.
So usually the top two or top 3, they'll make them skip the class. So I usually used to be number 1. So I skipped from grade 5 to grade 7. And even in grade 7, I was still doing well. But then I was still very young. I was missing my parents. So I decided to go back to the rural area. And remember, my parents were what was considered rich. So I used to have everything the time I wanted. So I missed that. So I went back home.
So you were spoiled.
Yeah, my parents provided me with most of the things that I needed. But they were not spoiling us. They were giving us the basic needs. And then they emphasizing education. They will tell us, in terms of education, whatever you do, wherever you want to study, we will provide for that.
Yes, but remember now, when you move to Matadin, you miss the
true.
Your life of home and you went back home. So that's why you were a bit spoiled, but it's fine.
Not true.
You got your marks. They were not so good. But then you decided to go to university. You went to Westville, right?
No? Yes. No. No, but hello?
Yeah, I'm listening.
So what happened? Then I came back to Newcastle to instead of standard 6, which is now grade 8 anymore. So I wanted to go back. I went back, but it was 2 things. Also, the first 2 were promoted from grade 8 to grade 10, and I was number 3.
Yeah.
And I was angry. I didn't want to do grade 9.
Yeah.
Then I decided I'll make a plan to go to Newcastle. So I tried doing that. It didn't work.
Yeah. Okay.
So and someone advised me that, they won't pick you up. So I went there.
Doc, I don't know what's happening with your phone, but we're starting to get some issues with your phone now. The quality of the conversation was good.
I jumped now, grade 9, and then grade 11. So obviously you're doing something.
Doc? Dr. Sithebe? Doctor?
Yes?
Your line is breaking. We are starting not to pick up, what you are saying. Maybe what you could do in the meantime, switch off the camera, but let's continue to talk while somebody tries something else, please. So switch off the camera. Let's continue to talk. Please switch off the camera so that we can continue to have our conversation.
Switch off the camera.
I expect that Dr. Sithebe. All right, technology does not always work with us. We had a very good line from Dr. Sithebe, but for some strange reason, the quality of the signal. Yeah, so it's just affecting the quality of our conversation. So she's getting people to assist her to try and get things improved so that we can continue with our conversation. So please bear with us. we will get things right. You know, like we say, you know, we are advancing in terms of technology, but also some of the situations we experience teach us that technology does not always, work with us. So let's allow her to restart, that is to connect with us again. Now, she had decided to invite Bunolo Mushi. So while she's trying to connect, can I connect with Bunolo? Please, can you unmute yourself and also switch on your camera, Bunolo? She said you guys have been friends for quite some time. So whilst we're waiting for her to connect, can we? Right. Thank you. Thank you. Thank you. Thank you, Bunolo. Right. Welcome. 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 I was going to bring you in a little later, but because of the technological challenges, we are bringing you now. How are you related? You know, or your relationship with Dr. Zanele Sithebe, Umazet, iqale kuphi? Where did it start? I mean, she says you know everything about her.
Okay, thank you so much for inviting me. Well, Dr. Sithebe is a very good friend of mine. We met at medical school, but our friendship was strengthened at Sebokeng Hospital, where she was, when I was doing internship and she was doing her ComServe.
Yeah.
So she was in anesthesia, and so we were rotating everywhere else, all the other departments. Basically, it all began, and we've been since then. I must say, Dr. Sithebe is just an amazing human being, in a sense that, you know, throughout the years, I have actually witnessed a woman of strength who managed to tap into her power to leave an incredible mark wherever she goes, be it at work. She's an excellent anesthesiologist right now. At home, she's an amazing mother, and socially, she is an amazing friend. She has got integrity. Like she said, she learned that from very early ages. She is somebody who is very honest, somebody that you can count on, you know, anytime. I phone Zanele any time of the day for whatever issue. We manage to talk, we laugh about things, we cry about things. And she, I must say, she has inspired me as well, you know, from back in the days. Her journey to become an anesthesiologist was not an easy path. You know, as a registrar, there's lots of obstacles along the way. But, you know, through her perseverance, her resilience, and, you know, her focus, she managed to finish, to get to the finish line. At the time, I was also, you know, I'm a doctor myself, and not undecided about which area to specialize in. And she kept motivating me. You know, we told ourselves, that group of interns, that those years, that we have to be specialists, you know. So Zanele was just one person who really motivated us, and we were inspired by seeing her working hard against all odds and managing, you know, writing College of Medicine exams. It's tough. And being a registrar as a mother and having other responsibilities is not easy. And I must say, sadly, when she was a registrar, she lost her mother, you know, so you can imagine how rough it was. Yes. But, you know, Zanele did not give up. She did not give up, tough as things were. She went through her program and she managed to get to the finish line. So I must say, she's one gold.
Did you get to specialize when?
Oh yes, I am actually a dermatologist. So yeah.
Now I remember you remember?
Yes.
And you asked a few questions.
And by the way, and you still owe me, hey? You still owe me some feedback.
Yes. No.
Yes.
We worked on it. All right. So
we'll get back to that.
yes. So basically, you guys, since the time you were, at Sebokeng, you've just been tight. You and Dr. Sithebe, you've been friends since the
We
time.
have been very tight.
Yes.
Yes,
All
I
right.
think it was in 2003, actually.
All right. That's the reason why then she said, please, I want to have Dr. Bunolo Bushiana with me because she's one person who can testify and share a lot about me. And so I'm actually happy, and the situation has just forced us now that you actually do that testimony, earlier than before. So why dermatology, when?
Well, you know what? My interest in dermatology started when I was working at the local clinics as a primary healthcare doctor.
Yeah.
It was early on where we saw a lot of dermatological manifestations of HIV.
Yeah.
And at the time, we were battling, to make diagnosis, to even treat patients.
Yeah.
And, because, one wants to do something and do it very well, I got frustrated in trying to treat skin diseases, but doing it right. Then I started having interest, I started asking around, and I must say it took me a lot longer than it should, because you know that getting posts in dermatology was not easy.
It's always a challenge,
but with perseverance,
and there's always few registrars. Yeah.
So it's quite a challenge, but you know what? When you want something, you go for it, and that is something that
Doc?
I learned from Zanele. She wants something, she focuses on it, and she goes for it.
Lovely. Congratulations. So where are you practicing from now?
I'm practicing from various places. I'm in Dainfen and at Mediwell Center and at Pine Haven, Netcare Pine Haven Hospital in the West End.
Yeah. Okay. No, that's good. So you are like a Holy Spirit. You are everywhere.
Because we are few, we have to make sure that we cover all areas where there's a need.
No, beautiful. So we are going to cross back to Dr. Zanele. She is now settled. I can see she's smiling, nice and relaxed. So yeah, we'll get back to her. Then I'll bring you back again. Thank you for helping me to fill up the gap. Dr. Zanele.
Okay, Doc.
Let me unmute her. Right. All right, Dr. Zanele, can you unmute yourself, please?
Okay, done.
Yeah.
Hello. Are we back? Sorry about that.
No problem. Yeah.
Yes. Right. So I was explaining that I jumped so many classes, and I was doing science. So obviously, if you're doing grade 11 without the background of grade 8, it's going to be a problem. So by the time I got to matric, I was still trying to catch up with the work from grade 10. Yeah. So obviously my matric results would be affected by that. So that affected me a lot. It was a bad decision.
That's fine. But anyway, so you wrote your matric, results were not the best, but what then do? I want us to move quickly now to university and work life.
Sure.
Doc?
Yes, I'm here.
Yeah,
okay, so I passed matric. Passed matric, and then I went first to Medunza because that was a school that I knew offered nursing and some health science studies. So I went to Medunza. I hadn't applied. I went there. I was 14 years old. I had never been to Joburg. But now for the first time, I took a taxi, went to Joburg. From Joburg, went to Garankuwa, and then got there. When I got there, it was late. I couldn't even tried to register, they tried to look for the space.
Yeah.
Fortunately enough for
Yeah. Okay. I'm not sure what is happening with Dr.
that they were full.
Yeah.
I then went to University of Kwakwa. University is called Unikwa.
Yeah.
Yes. I went to Unikwa, and then when I got there, the SRC guy said, "What subject did you do?" Then they checked, said, "You go do BSc." So I was there for a year doing BSc. The first semester I passed 3 subjects. The next semester I failed all of them. Like I got around 47.
Yeah.
And at that time, my sister was already doing a BPED degree at the University of Zululand. So the stories that she used to tell me about the University of Zululand, what I expected to experience there, I wasn't experiencing it. So I felt like, nah, I needed something better. So I told my dad, no, I don't want this university. And then he changed me and he took me to the University of Durban-Westville.
Yeah.
So I went to the University of Durban-Westville, where I started the BSc all over again.
Yeah.
And then when I got there, it was tough. It was tough because here I was, a village girl. Remember, in our schools, they used to teach us even English subjects in Zulu. So my biggest barrier was English. But now, on top of that, I'm doing science. So there's a lot of scientific terminology that I have to learn. And also our lecturers were Indian. So now they also I was interacting with Indians for the first time. So there was this accent. So now I had to deal with the language barrier, the science problem, and with the accent. So the first year obviously because I couldn't take notes in class. Yeah. And also another stumbling block I met is that I didn't know how to use the library. Yeah. So I didn't know how to catch up on the work. So the first year I failed because basically I spent the year just acclimatizing.
It was just about adjustment or acclimatization.
Yes.
All right.
Then the second year at UTW, then I started doing better. I passed. So I passed the second year. From second, third year, actually I started doing better. So I was getting an average of 60. I remember, I think for my second year, I even got a bursary that was meant for chemical engineering students.
Yeah.
So I decided, because I was feeling bad that my dad had been failing for so many years. So I wanted to help him out. And I applied for this bursary and I got it. And then I went to the third year. Then I was still doing well. Then I finished. So while I was doing BSc, our friends, our friends, that our classmates, most of them either did first year and then from there they went and did medicine, or they'll finish BSc and do medicine. So one of such friends was he's now Dr. Makwakwa. So he had done first year and then left UTW to go to Medunza to do medicine. Yeah. And then I wanted to follow in his steps.
Okay. All right.
Yeah. So, but unfortunately for me, because I had a bad academic record, each time even after I finished my BSc degree, each time I applied, I wasn't accepted because they left few spaces for people who already had degrees. They were more interested in fresh students. Yeah. So I tried the first year. After I finished, I tried. They didn't take me. Then I went on to do an honors degree in physiology. So I did that, and I thought with that I have extra points. Then that they will take me. They didn't take me. Then I went on to do masters. Yeah. And then I did my full year of masters, nothing. And then when I was doing my second year, actually after the second year of my first year of masters, I gave up. I'm like, if it doesn't happen this year, this is it. I've given it my best shot. I have to think about finding a job or something like that. So that particular year, I had given up. Yeah. It so happened that my best friend Sbu at the time, he was already at Medunza doing medicine, and her sister, Dr. Sidingwe Makwakwa, was also doing dentistry there. And then she happened to join the SRC, and I think she became the president of SRC, or she was top management in the RC. Top, yes. And then she paved a way it was him, herself, and her family, the entire family came together to get my application, and it was curate. Her dad drove from Soweto to Medunsa. Oh, that family, I'll never forget them. Like, when I had given up on my dream, they're the one that pushed it. I became a doctor mainly because of them.
Yeah.
And I'm forever grateful to the Makoko family.
Yeah, there's two things I want to ask from you, Doc.
Yes.
You know, we always look at people who have succeeded and think that it was smooth sailing. But you've just told us that you had very challenged educational background. We are called. You also had challenges around tertiary, you know, at some point you failed, right? But your eyes were still focused on your dream, right?
Yes.
Now, it's important for me to highlight these things because a lot of people sometimes give up on their dreams. So what was it that was actually still driving you to say, I am still going to try, I'm still going to try, I'm still going to try. I'll look at all the other different ways because I really want to get to where I want to get to.
Hey, Doc, you know it. You're a doctor yourself. Medicine is a calling. It's an obsession. I don't know. Once you've been called to medicine, you can't do anything else.
Yeah.
You can't do anything else. I could not see myself being anything but a doctor.
Yeah.
And it was the best decision. I tell you, my friends, they even used to call me a Medunsa because all I spoke about was I want to be a doctor.
Yeah.
Everything I did was leading to me becoming a doctor. I dreamt about it. I talk about it. Everything I did revolved around me becoming a doctor.
Yeah.
So that was a kind of a conviction. But I'm generally like that with everything that I do. I'm obsessive when I want something. But you know, when it comes to medicine, once you decide you want to be a doctor, and once when you know now it's possible, because people that have done the same course as me, because all along I thought I didn't qualify because I'm a village girl. I had bad matric results. Now I see people who have done the same course as me, because most of my classmates, as soon as they finish at UGW, they'll go to Medunsa and do medicine. So now that I knew that I was capable of doing it, then there was no stopping me.
Yes, lovely, lovely. So your adjustment in Medunsa, how was it? You know,
you know, there's two things. So sometimes I ask myself, was it the age thing? Okay, the language thing and not being able to get study material was an issue. But I also think the age thing, because remember when I went to Kwakwa, I was 14.
You were 14.
I actually did my first exam when I was still 14. I turned 15 after writing my first semester exams, because what I saw happening on my second year, from my second year BSc degree, I started excelling. That when I got to Medunsa, the first year I got distinctions. I got distinctions in all my subjects in my second year.
Yeah. Okay. So anatomy, physiology, you just
anatomy and physiology, I got distinctions. And then in third year, I got a distinction for microbiology. I actually got even an award of some sort.
Yeah.
I was the third top student in the entire class for microbiology. Then in fourth year, then my focus now became every subject I want distinctions, especially subjects that were difficult. Remember, in fourth year, there was chemical pathology. I even still have a backache from that subject. I used to sit reading throughout everything. I didn't do anything else. I was reading all the time. I got that distinction in chemical pathology. All the way to, even in my final year, I think I got 4 distinctions in my final year medicine. I became obsessed with reading. I became obsessed with examining patients. I even remember when we were on call, because Medunsa were kind of a big class. So when we were on call, there'll be 10 students. The way I became smart, all the students in my group, they will want me to examine their patients before the consultant came. So when they're on call, they will see one patient. I would have seen 10 because all of them wanted me to see the patient and make a diagnosis for them.
Yeah. So
and towards the exams, I used to sit the group that did calls with me. I will sit them down and be like an examiner and examine them and tell them, if you have a patient like this is how we approach it. So all those things make me even better than other students because they gave me chances.
So the story then here is, it's not how you started, right?
Yes.
That was bad, all right, for many reasons. But the finishing, as you are now finishing, getting closer to that dream of being a medical doctor, you were actually now excelling, you know?
Yes.
So I think the lesson there for people that your circumstances, your past, your background is not an extension of the future. All right? Meaning, don't write yourself off just because you started badly. Because somebody like you actually has demonstrated that you can have a very good teaching and attain your goals as long as you persevere, you're focused, you have hard work and all of that. So when you finish your final year medicine, did you get any awards?
Not awards, but I got distinctions, but I felt like I got recognition because what happened is that so we used to do blocks, and you do exams in that block. So I did my internal medicine. I remember I did so well in my internal medicine block that I was at a level higher than a student, that the examiner that took me for that, I was the best student for that day in internal medicine, that the lecturer, it was a white woman. I later met her a year later. So I did my internship at Folate Hospital. The way I had impressed her, she remembered me from the year before. She asked me, are you not that good student at Medunza, blah, 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 blah. That's how good I was. Yeah. And even as a student, there were a few cases whereby when we were on call with a registrar, I would actually examine a patient and call them and say, hey, but you misdiagnosed this patient. I remember the one patient was diagnosed as pneumonia. But I examined the patient. Patient had a silent chest, had a severe asthma. Then I changed medication. Then after I changed, I asked the senior to change the medication. And after they put them on asthma treatment, then they started wheezing, like severe wheezing. Yeah. That's one I do. Another one is a patient that was admitted with gangrene in the surgical ward. So they thought, I don't know what the gangrene was from. Then I examined the patient. Then I picked up the patient had MEMAS. So patient had a cardiac lesion that led to a patient shooting. So it was those kind of things that distinguished me.
So you were actually very confident to an extent of challenging your seniors in terms of the diagnosis that they made, you know, and that tells you that you knew your stuff. All right.
Yes,
so you qualified, and then you had to do your concept. When did you decide that, no, man, I like anesthesiology? Because you did your diploma in anesthesiology.
Fundi, I'm sorry to do this to you, but I have to mention something before we get there. So when I went to Medunza, I felt bad for my parents that they have many children, and I didn't want them to continue paying for my education. Then I told my dad I don't want him paying my fees anymore. So he took me to school, and then there's another story. I don't know if you want me to tell you how I got a bursary that paid for me.
The Japan one. Now you can
the Japan one.
The Japan scholarship.
Yes, yes. Do you want me to tell the story?
Briefly.
Okay. All right. So basically, now my second year, I get 2 distinctions, and I'm confident that since I have distinctions, I automatically qualify for some funding from the university. The university sent me back, said, no, if you can't pay for previous year's fees, we're not registering you. So and then they wanted my father to sign something that they'll deduct a certain amount of money every month to pay my previous year's fees in order for them to register me. Then I I refused. I said, okay, Dad, just go home and make a plan. So I met with friends and we decided what to do. So I went around looking for a sponsorship. So I went to a certain office in Joburg, because one of the cousins of my friends had a sponsorship from there. They said, no, it's in January, we can't give you money. And then on the taxi going there, I was getting lost and I was finding, then people asked me, where are you going? I told them I'm a student, I'm a medical student. And then they refused to register me because I don't have funds. And then someone in the taxi gave me a number. I said, take this number. This is an NGO from Japan. They have helped me. Maybe they'll help you. This is how I got the BLL sponsorship. That in the end, so it started with me. So I phoned them. They said, come for interview. There's 2 of you. One of which will get the sponsor. Then I knew. Then I said, I got a sponsor meant for engineers doing health sciences. So this one that's meant for me, I will get it. So I went there, and the 2 of us, I competed with the guy, and I got the sponsor. In the end, that sponsor from Japan sponsored 100 students at Medunsa. I brought it into the university. When they came to pay, I would be in the boardroom with the deans and other people. So for me, I'm very thankful to the Japanese people for helping me and the other students, like Dr. Ndiviwe, who was on that COVID thing.
Yeah.
He was one of the advisors. He also was sponsored by the BLL. And yes, I'm very grateful to the Japanese.
So as you were being empowered or being supported, you actually helped others to also benefit, you know?
Yes.
Lovely story, Doc. All right, so let's get back then to you finish your internship and the concept. How did you get to then develop an interest in anesthesiology?
All right, that's another interesting one. So what happened is that the same friend of mine, Busiso Makwakwa, had recommended, because he was a year ahead of me, so he had recommended there's Bukeng, and what's the other one? He had recommended another hospital, the one that's in the West End. Yeah. He said I must come and do my internship, my concept there, because it was good. Because I'm Zulu, for me, that hospital and Sibugeng sounded the same. So I chose the wrong hospital. So by the time I realized, then I decided, I thought I'll be able to change at some point. So I didn't choose, because when you choose a hospital, you also choose the department of interest. So I didn't do that because I didn't want to go to Sibugeng. So I ended up taking the rotations that nobody wanted. So anesthesia and casualty, nobody wanted it. That's how I ended up in anesthesia and casualty. So now I decided casualty, for me, I thought, because emergency medicine is an emerging specialty. There wasn't before. So I thought I want to do something that can lead to specialty. So I said, let me rather start in anesthetic and do 6 months anesthetic, and then after that I'll go do casualty. Then I'll decide what I want to do afterwards. You won't believe, when we were in medical school, we did all the rotation, anesthesia, all the other. When I did gynae, I thought, I'll be a gynecologist. Psychiatry, I'll be everything else I had interest in except anesthesia. I said, never. This one, you just sit and look at patients. Never, it's too boring. I'll say I'll never be an anesthetist. Then I did the anesthesia for 3 months. Then I fell in love.
What was the attraction? What made you to fall in love with this discipline that you actually didn't really have any feeling for?
What happened is that I always wanted to be a physician. And I also liked emergency medicine. So it was a combination of my passion for being a physician and my passion for attending to emergencies. So it came together. But also with anesthesia, when you are an intern, because you're not hands-on, it's too critical. You can't let an intern take over the whole anesthetic. So you don't get to appreciate what actually goes on in anesthetizing a patient. So that 3 months being immersed and understanding what it means, because from the onlookers, you think, these ones are doing nothing. They're just sitting and watching monitors. And you don't know that you do a lot of work pre-op. Most of what you're doing is in your brain.
Yeah, Doc, you know, we're gonna get there. Remember yesterday I said I want you to give us run up.
Yes. Okay. Okay.
Yeah. You know,
Okay.
so you got to anesthesiology by default, right?
Yes. Yes. Yes.
But you fell in love with it,
Mm-hmm.
right? Now,
Mm.
for somebody who did not go to medical school, all we know is anesthetists are people who make you sleep in bed. You know, those people, that's all they know. Abalali, they just make you. But just for people who don't know, without going to town, what is the role of an anesthesiologist? When do you start to see a patient, you know, for an operation? And what is it that you do? And on the day of the operation, what do you do? Is it like a pilot, you know, where the pilot just worries about the takeoff, and once the aeroplane is up there, it can go on autopilot, and then just before touchdown, again, you worry about the touchdown, or there's stuff that is done.
All right. Okay. There's two things. There's an anesthetist. Anyone who does what I do, even when they are not specialists. So you can go and work in a government hospital in the Department of Anesthesia and work there for a year under specialists or other medical officers with experience. So once you are confident enough to give the anesthetic, you called an anesthetist. Yeah. But anesthesiologist, then after that exposure, like I stayed 2 years at this one hospital, at Sibugeng Hospital, and did a diploma. Then I went to vets, and then I was stationed at Charlotte Macao Hospital. So the actual training is minimum 4 years, where you actually are trained in the art of anesthetist, then you become an anesthesiologist. Okay, so basically what it entails, you basically 4 doctors in one. You are a physician, you must know surgery, you must be an anesthetist, and then you must be you must have some critical care knowledge, because you go. So now doctor will give you a list. It says, I have a 55-year-old patient that is coming for a hernia operation. Okay, so you go and see that patient, and then you assess them. You do a physical examination where you check, are they having any medical problems, any issues? So their physical status. And then you go also, you have to learn about the operation that's being done. So in order for you to anticipate what problems, potential problems you're going to face during the surgery, you need to understand the surgery that's being done and the different steps in that operation, because different steps come with different complications. So when as an anesthetist, that is why we look like we're doing nothing and sitting in theater, because all the work you've done before. Yeah. So I go there knowing. So now we come to theater. After I've examined you and I've decided, are you fit for anesthetic? For instance, if you're asthmatic and I examine you, you are wheezing. I cannot take you to theater until the wheezing is resolved. So I need to first treat your asthma, recommend a physician to treat your asthma or your high blood pressure or whatever condition you come with. Now, when it's treated, but it will also depend on whether the operation you come for, is it an emergency or not. So if it's not an emergency, then you can take a week to sort out whatever problem. But if it's an emergency, I need to take you to theater, then a few hours, I try to optimize you to bring you to the best possible you can be under the circumstances. Then I take you to theater, and recognizing that I'm more likely to encounter problems because your underlying problems have not been sorted on. And usually emergency surgery on its own comes with problems. So I know I have a difficult patient. So yes. When we now get to theater, so we do, okay, so now in theater, I have to understand, I have to make sure that the anesthetic machine is working properly. It's been tested on this particular day, all the things that I need. Then I have to prepare the theater for you specifically. A man will need different things from a woman.
size, in terms of sizing of things and dosage. A child will need a different circuit altogether. The entire thing is different. The physiology of the child is completely different from an adult. So it's those setups, and even the drugs, I need to have emergency drugs, then I need to have anesthetic drugs. So say now you're in theater, I put you on the operating table, we put the monitors. Now it's the drugs. So there's drugs that I must give you to induce the anesthesia. This is the part I like, because patients, they see you up until you put them out to sleep. And there's an assumption that we make a lot of money because we put someone to sleep and off we go. Off we go to do another operation. So putting someone to sleep, that's the takeoff. So like you said, our job is definitely, it's similar to a pilot, because the most difficult part of the job is putting someone to sleep, because this is at the point where you make them stop breathing. You essentially, at that point when you put them to sleep, you take over their being. You give them oxygen, you have to control their blood pressure, you have to control their heart rate, everything you do for them. So when you put them out, you essentially, I don't want to say this, but you're like they're small gods, because their life is entirely, literally in your hands. And then they do, okay, so you put them to sleep, then you use a different drug to keep them sleeping. So you induce the sleep, and then you use something different to keep them sleeping. Then, yes, then the surgery starts now. They do whatever they're doing. So during the operation, you assess, do they need more drips and stuff like that, pain medication, antibiotics. If they're bleeding from the surgery, you treat the bleeding. Certain manipulation causes maybe a drop in heart rate, you treat that. So you just there monitoring everything that goes up or down. You there to bring things back to normal. Yes, you balance. Then when the surgeon says they are done, then we generally use muscle relaxants that makes our operation, it makes work easy for the surgeon. So you reverse that one, and then you also now reverse the anesthetic. So you switch off the gas, then they start working up. Then now you have to assess them. That's another one. This is like you landing. So you took off, now you landing. Landing now, you have to make sure that this patient, you bring him back to the state that they were, meaning they have to be awake. Maybe the awake part is not that important, but the main thing is that they are able to maintain their own vitals. So they must be able to maintain their own blood pressure. They must be able to breathe effectively. They must be able to maintain their own oxygen. Until you've done that, you cannot leave the patient alone. So once you are happy that you've done that, you then hand them over to the recovery staff. So they also continue for another 20 to 30 minutes to make sure that you've done the right thing. The patients, they are back to what they were pre-op, at least close to that they can be sent to the ward. Remember, in the ward, maybe there's one sister for like 20, 40 patients. So you can't take someone to the ward who still need just close monitoring or stuff like that. So basically, this is what we do.
Lovely. I think you put it so easily that people can actually, like I said, that analogy of takeoff and the touchdown and with all the calculations and everything, it actually gives a very good picture. Now, Doc, your responsibility as an anesthesiologist, when does it, to say, okay, after 4 hours it ends, after this it ends. So, at what point do you say, okay, now that person's surgeon is responsible for the person? So when does your responsibility end?
Well, it depends on the kind of patient. If it's the patient that you intending to wake them up completely, say as soon as you ascertain that the patient is awake enough, can breathe by themselves, blood pressure is fine. Once you hand over to recovery and you both agree that the patient is fine, so they stay around 30 minutes in recovery. So you generally stay around the hospital for that period, because generally there is a criteria that we use to discharge them from recovery room where they go. Once they're in the ward, generally they don't even call you. When there's problems, they call the surgeons. And then certain patients, they go straight to ICU. So the ones that go straight to ICU, it's even better because you hand over to another doctor. and the nurses will be there monitoring the patient continuously.
Yeah. So I'm just gonna ask you maybe an uncomfortable situation, and I don't want you to use any names. I mean, that would be unethical. But what kind of experiences have you had that really challenged you, where you thought this patient, you know, it's touch and go, no? And talking in general.
Doc, I don't think I understand your question.
I'm saying, as umlalis,
Yes.
most times things go well, right?
Yes.
Able to do everything. So I'm just asking you for that, for those few times where things did not go well. That was the kind of problem. Where you thought, it's a touch and go here. You know, I nearly lost the patient.
Well, it happens. It happens in theater. Like I've had a patient that we're doing a spine, like fit mid 40s patient. There was not even risk factors for heart attack.
Yeah.
As soon as we put him on his tummy to do the back surgery, and the patient got a heart attack. But fortunately enough, I think we hadn't cut. We think, I don't know if we've cut, we close. We've cut the skin. Yes, we've cut the skin, but we haven't started doing the actual op. So suturing the skin is easier. So I was able, because this is the kind of monitoring that you're doing. That usually, like we said, once you are on air, things cruise most of the time, but you do get turbulence. So you get things like that, or you get patients that suddenly bleed excessively, and you're not, I remember as a ComServe doctor, we had a patient that was coming as a Caesar. Remember, I'm just a fresh anaesthetist. So patient coming for a cesarean section, then the next thing I see heart rate goes 90, 100, 150. Well, so I'm confused. What is happening? What's going on here? And I have a consultant person doing the operation. He's not saying anything. Then I realized later that the patient was bleeding. And a lot of things like bleeding, when you read, books and patients, totally different things.
Yeah.
You will read things and get 100% on paper. When you actually faced with patients, what appears to be very simple on paper is patients are very complicated. So you get those kinds of situations. But I must say, being a specialist, what drove me to take this route of becoming a specialist is those kind of occurrences. Because if at that time I was an experienced person, now I know when I got to Barra, where we did a lot of obstetrics and gynae, you knew that kind of a patient, when they come to theater, they're going to bleed. So beforehand that you have to have blood before you cut them. You have to have big lines. You have to have all those things. So those are all the kind of things that you learn as a specialist. You don't just go, it's a Caesar, because they will tell you that it's a intrauterine pregnancy. For me, it didn't mean anything. We lost that patient.
Yeah.
So those are the kind of experiences that compelled me to go back to school and specialize.
Yeah. All right. So looking back, I mean, let me just ask first. Anesthesiology is one area where artificially numbers were kept, especially for female and maybe black people. There were not many people in the past who were allowed to do that space, at college level. So how are the numbers? Do we have a lot of black anesthesiologists, female anesthesiologists?
Well, things are a little bit better now. Like when we started off, we're actually told you're in the wrong. We're told actually straight that you're in the wrong field. Black people now, they're not cut out for this kind of things. You can do gynae, orthopedics, not anesthesia. You need to be able to think 3D to be an anesthetist. So that was one. And number two, you're a woman. You guys, you're gonna be pregnant before time. And once you're pregnant, it's game over. You're never ever going to qualify. And they were right. All the women in the department, before we finished, were pregnant. But So we started as a group of 8. We were the biggest group that vets has ever taken. And we broke the record. All 8 of us qualified. But for many years after us, there was no one coming out after us for many, many years. But now I see, I'm meeting you, consultant, come out. It was terrible. We're like, you know, I would get calls from Cape Town. I'll get calls from Durban. I'll get calls even from Pretoria. That's how few we were. That in the country, people don't know that there is Zanele in Joburg. So people will phone me and ask me to teach them on the phone to prepare for exams and stuff like that. But now it's getting better. It's still not close to where it's supposed to be, but it's getting somewhere. You know, like I remember when I worked at Brenthurst. This was 2000 and so I finished my race time 2009. The sisters were actually on the corridor, ululating. They're like, wow, this is, you know, like we really in living in new times. A Black female young anesthetist. It was the biggest thing.
Yes. And so when Nagaman as one of the top female Black anesthetists, is there anything that you are actively doing to pave way for more younger people to actually follow in your footsteps?
You know what? The best thing to do that would have been to stay in the academic setting and teach, because what we found is that I did have Dr. Mqenge and another doctor that were Black. But the thing is, you find that you don't have a lot of people supporting you when you are training. So we had thought we'd stay so that the other generation, when they come, they are there and they're supported. But you know, if you've been in school for so long, you have things you need to catch up. I mean, if you count the number of years that I was at varsity, you know, you want to catch up. So that's one part. When I finished after finishing my reg time at Vest, the way it was so difficult, like the hours and everything, I left and worked at the at Tambo Memorial, which is in Boksburg.
Yeah.
So there, indirectly and directly, I've influenced a lot of people, because for the first time, like I was in my mid-30s, but I looked like I was 20-something. So people were shocked to see such a young specialist and a local one, because a lot of Black specialists that were in private practice were foreign doctors. So for a South African Zulu-speaking young woman being a specialist, it was unheard of. It was unheard of. So a lot of medical officers, they were inspired by me. Some will come to me and talk to me. Some of them indirectly by my presence. Like we'll be in consultant meetings. They'll send me for water because the people I will be with, they'll see me as a child. I look like a child amongst the elders. But that my being there and them seeing what has happened to me, it motivated a lot of people that there's quite a few doctors that I can mention that after they qualified, they came back to me and say, because of you, I'm a specialist.
Yes, beautiful, beautiful. So to that child who is still in the rural area at Gandhi, who's got big dreams, but the circumstances are such that I'm not sure if the dreams will ever come true. Do you ever maybe go and talk to high school students or something, encourage them, you know, that you know what, your circumstances don't determine how far you can go?
When I interact with anyone, I always tell people that you must never ever let your circumstances define you. You know, even when the COVID started, our practices were collapsing and things like that. People will phone me and be falling apart and be like, oh, COVID, this and that and that. The financial aspect of it. I'll tell people that if we are falling apart, we have established practices. We are doctors. We can get up this moment and go to Canada and work. If we are falling apart, what will happen to the other people? And also, I would tell young children that your circumstances should never define you. I'm not defined by my circumstances. Like at Vet, before I even went there, I was told that you will never qualify. You will never. So as a result, I had a motto. I'll be like, if if it's been done by a person with 10 fingers, 10 toes, one brain like me, I also can do it. So apparently I used to say it every day that no matter what, I'll be a specialist. Apparently I would say that over and over. I would say I can be delayed, but I will be a specialist. So I have that kind of mentality, not just with the education aspect or the career aspect. In general, I have that attitude. When I want something, it must happen. I don't give up.
Lovely, lovely. And Ubaba, you know, your dad, what was his reaction when you eventually got to this top specialist? Remember, he sponsored you up until masters, and then you made the plan for yourself, and you got the Japanese to fund you. But still, I'm sure he was, I mean, very, very, very happy to see your progress.
Sure, that man. Yeah, that man, I can never thank him enough. You know, like when I was doing my final year, when I was doing the masters, he had said, Zanele, I have supported you. No, first of all, when I was busy failing, he never complained. He never even suggested change your course or nothing. He just said, Mtanami, you still want to go back. And you just, nothing. I'll go back and fail. He would support me. And then after I finished, when I was doing my last year in masters, he had said, Mtanami, tata a break because now you have other siblings, whatever. But the minute I was found to be told that I got accepted in medical school, I tell you, he made me, because I was in Devon at the time, he made me halfway in Ladies Need to give me registration fee. That I took and went and registered and then he was supporting me for the first year, and then the following year when I did the third year, that's when I got the sponsorship from BNL Japanese company, NGO. My dad, he's overwhelmed. He can't, but I don't think he understands the magnitude. Like he doesn't understand how big it is to be an anesthesiologist. You know, like at some point I'll be advanced and I'll be thinking to myself, here I am with my average E, with my broken, you know, not even broken. I didn't know how to speak. Spoken English was a problem. Spoken, like, may I go to the bathroom? I didn't know how to construct such sentences. I will watch TV in the TV room with the other students, and I will not get, they'll be laughing, all of them, but I'll be left out because I'm not understanding English. So to have that kind of a background and come to Joburg, go to vets, and be admitted to the College of Anesthesiologists, the fellow, I've become a fellow in the College of it's the highest honor I can ever imagine. Even in my wildest dreams, I never thought I'll come this far. And my father is very proud. My whole family is very proud of me.
Community okhulele kuyo yona ithini?
You know what, Fundi, you know, the thing is, after 1994, my dad bought a farm and we moved to a farm. So we have limited interaction, yes, with the people from the village.
Okay.
Some of them are meeting them now on Facebook and stuff like that. Because remember, I left home when I was 14.
Yes. You know what?
And then from there we moved to the farm. So we don't have a lot of. There is a shop still. There's still that bottle store in Matameni, but I'm busy. I don't interact a lot, I must say. But I'm sure they are proud.
Yeah. During the time you had some technical challenges, we got to Dr. Musolo to actually just help me better understand you. But there's something that she mentioned, that you lost your mom in 2008, right? Yet you were still able to push, you know, and push towards your dream. But can you just quickly just tell us, how did that affect you? You know, in the middle of your push, and then you lose Daligas.
That is another story. Well, during my 4 years of training as a specialist, my rest time, I actually lost 3 people. The first person I lost was my cousin sister, who I regarded like a sister because we grew up together in the same house. Everything. She was my but she was raised by my parents, so she was my sister. she died, and she was the one that was looking after my child, my firstborn. So it was the three of us. Now she is gone during my rich time. Now I have to find, I have to start finding nannies and stuff like that. So that was the first one. And that was the beginning of hardships, because, oh my God, being a registrar and relying on nannies, our helpers was something else. So that was the first one. So I passed that one. Then the second one. So my mom has been complaining, having these complaints, but and I just thought, this is old age, blah blah blah. It turns out she has a brain tumor. So they diagnosed this brain tumor. So initially I took her to ENT. They treated her, she got better, and then the symptoms came back. Then eventually she had a CT scan. Then I took her to a neurosurgeon that discovered a tumor that was in all parts of the brain. So when we got the scan, we knew that she had like at least 6 months to live.
Yeah.
But now here I am, highly pregnant. I was 8 months pregnant. 8 months pregnant, broke as hell, going through this rich time. At that time, doing senior rotation, doing these big things. So my mom had to have radiation therapy. Okay, before we get that, so my mom gets diagnosed on Friday with a brain tumor. Yeah. Then she's admitted in the hospital for stabilization. So I brought my little brother from home, who was 26 years old, so that he can stay with my mom when I'm at work, or help her when she's attending doctors and things when I'm at work. And then on Tuesday morning, my brother died.
How?
My brother, we're busy watching TV around 5 to 9. He goes out, he smokes, comes back, he's laughing, goes upstairs, because my elder sister had come from Joburg because my mom had just been diagnosed with the brain tumor. So they came to see her. So we're sitting downstairs and her child is upstairs. They're busy giggling. Then the next thing, just after he went upstairs, we hear my niece, Guruwetsi, busy calling, Gebo. We're like, but why are you calling someone that you with? He says, he's not talking. Then I panic, I go upstairs. I get him upstairs. Well, I did CPR when I was 8 months pregnant, he was gone. Like I did CPR, it looked like he was coming back. I did CPR for an hour. That's how we lost him. Imagine at that time, my mom just received the diagnosis that she's got 6 months to live. And she's admitted in the hospital. My other sister, Busi, who's staying somewhere in Joburg, she was preparing for exams. Now we have to find a way to tell her without telling her that my brother has died, to go to the hospital and get my mother out of the hospital without telling her what is wrong. So when they got when they got to my place, then we like, leave mama in the garage, come inside. So they come inside, we break the news. Then now we have to break the news to my mother. And we were grateful that we did that, because my mom kept saying, you guys didn't make a mistake, because it didn't make sense. Someone was talking to us, now giggling, the next thing is gone. So now my mom is gone. Then my brother is gone. Even when I was phoning people, they thought I'm talking about my mom. So those were kind of things that, the hardships that I went through. And for so many other people, like close relatives around the same time. I think every month we're burying a cousin, someone. And then like a month before my mom passed, so my mom was, okay, so now my mom is sick, is staying with me, has to have radiation therapy. For her first radiation therapy session, I was discharged on Sunday after I had a cesarean section for my daughter Nadine. I had to come back, clean the house, Monday morning, take my mother, who she had such severe headaches that if you hit a clutch or anything on the car, she will scream from headache. So I have a baby that is 3 days old, being carried by a woman with a brain tumor. I did that for a week while I was trying to get a helper. And then at least at some point I got a helper. Then I took my mom for 6 weeks. In that time, I'm busy doing senior rotation. I'm expected to be ready for cardiac surgery at 7. I would leave with my mom. I'd leave Jamestown at 5:45 to be in Joburg before 7. So my mom would sit in the benches waiting for the departments to open at 8 while I'm busy doing these big cardiac surgeries. It was a tough time. In the meantime, I'm broke as hell. I can't even afford, you know, I remember I would take my mom to the hospital.
Hey, I'm sorry about that.
I didn't afford to pay 40 rands for her hospital fees. And she was so embarrassed. She used to be so embarrassed that I couldn't afford to do those things. I had made some bad financial decisions that made me to be that broke, but it was so hard. It was so now I was that broke. I was not broke. I'm having to deal with the pain of losing my brother who died. We don't know why he died because they refused to do a post-mortem for him. And then my mom here is dying, and eventually she died. And a month before she died, another cousin that I was close to the same way as the other cousin died a month before my mom died.
Yeah.
So, but it's, you know, it's one of those things that you have to deal with in life.
So when you look at your resilience and focus, I mean, none of those things, you know, those bad, I would say, losses of very close people, none of those actually derailed you from, you know, attaining it. You know, so when you look back now, what do you think of yourself in terms of, you know, because they normally say when you go through something like that, you suddenly realize how strong you are, you know, the depth of your resilience and all of that. So you know, pushing, yet there were things that were actually also very heavy on your heart. And you achieved what you wanted to achieve.
Yeah, it was tough. And that, my mom passing was not the end. I had finished my rotations and everything. It would take me another 2 years to actually become a specialist, because at that time, I felt like the only thing that will make it right for everything that I went through will be me becoming a specialist. Yeah. And that was not to happen for another 2 years. I would get 70 in all 3 papers. Trust me, anyone who is a fellow will tell you how difficult to get 50 in a fellowship exams. They're like one of the most difficult things. 50, getting a 50 is like, whoo, such an achievement. I used to get 70. I'll get 70 in one paper, 72. And then when I go to
oral
to the orals, they say I failed 3 times. And when I tell people, initially they didn't believe me. I had to get the papers and show people that, look, and even at some point I started even passing the orals, then they'll give me a patient, they say, no, you failed the patient, you misdiagnosed the patient, or whatever, you missed something in the patient, we can't help you. So imagine, like, I'm holding on so much to this because I'm feeling guilty that I was not there for my mom enough. I was broke, you know, I could not give her the life that I wanted to give her before she passed. But this is the thing that kept me from doing that. Yet I'm not getting it. So so I pushed, and eventually I got admitted in the fellowship in the College of Anaesthetist, and that experience has made me very hard in life. So now I know that whatever you want, you will get it if you push hard enough and if you persevere. And for me, I think when it comes to my children, it may be a disadvantage because I don't accept mediocrity. I don't accept I can't. That terminology, I don't use the terminology. For me, everything is possible.
You want excellence.
Yes. And I don't understand when you do something. I believe you have to give it your best. You have to push for it. So I become less understanding when people are feeling sorry for themselves and those kind of things, because I've proven it over and over. And life, the challenges doesn't end, because I thought then you get exam, that's it. No, it doesn't end there. You face challenges continuously in life.
Yes, but that experience of failing, but where you thought you should have passed, do you maybe think that it has to do with command of the Finns language. You mentioned Uguti, you didn't get a good grasp of it. You think Ama examiners they were victimizing you in that sense. You were not speaking like like somebody from the UK.
Well, that contributed a lot, because if you, in general, students or registrars that came from Model C and private school, they tend to do better than us. They tend to do better than us because they also belong with the crowd, because they behave the same way, they speak the same language, so that it gave them an edge. But also for me, what worked against me is that I left the circuit. As soon as I finished my 4 years, I disobeyed the seniors by leaving. And it was known that if you leave the circuit, forget it, you'll never pass. And I was passing regardless. I was teaching myself and doing very well. So it was more of making it, they didn't want to promote the culture of people living and passing. Unfortunately, it became impossible, because every single time I would excel.
Pass very well.
So I had that thing. Even when I looked at examiners, I look at them and I'd be like, you can fail me today, it's fine, but you'll never stop me. I always said, you can delay me, but stop me never. I'll become a specialist. No matter what, I'll be a specialist. So that mentality, I'll go to an exam room expecting to fail, but knowing that one day I'll be a specialist.
Yeah. So therefore, I mean, this is not long ago. This is, about 10 years ago. So when people talk about issues of transformation in the college, maybe they're not far from sometimes people are just made not to pass, not because they actually fail.
I didn't get that, Doc.
No, Ngeti. Your experience of not passing when you passed all your it points to the fact that sometimes some people are deliberately failed, not because
no, that's true. I'm sorry to... No, that's true, because I remember after I failed, the first time I failed my orals in Cape Town, one of my friends, I won't mention the university because I'll be mentioning the professor. So a friend of mine asked one of the professors that what happened to Zanele, because that girl is very good. Because at that time I was teaching them. I was at Wits, but she was somewhere in the country, but she would get questions and she would phone me and ask me to answer for her, and they knew I was very good. So she asked their prof, what happened to Zanele? You said, oh, you mean that girl that works in private? So the guy doesn't know me, but he knows my story. So I also broke another rule. You are told it's a rule that while you are a registrar, you're not supposed to work in private. So because of my financial issues, I started doing some private work in private work while I'm towards the end of my registrar time, and I paid for that.
Yeah. All right. Let's bring in Dr. Bunono, dermatologist, close friend of yours, being, Nigama PFFs, so Dr. Bunono, please unmute yourself. Right.
Are you talking to me or to her?
Now I'm going to talk to her.
Oh, okay. All right.
Right,
Okay.
Doc, there is your BFF. You told us a lot about her, but I think some things she needs to hear. You've told us everything, but what are the things that you say? These are the 3 things about Dr. Zanele, positives. And then what is that one thing that she needs to work on still? Because no one is perfect, right? there must be one or two things that we need to work on, but there are many good things about her. That's why you guys have kept this friendship for so long.
Okay, thank you, Doctor. I think I have said a lot of things already. Unfortunately, she didn't hear it herself, but but I mean, she already knows. So, you know, there's a saying that goes like, we are where we are in our lives because of the choices that we have made for ourselves.
Yeah.
So Zanele is just an example of that saying, you know, against all odds, she has said her story, and against all odds, she managed to be where she is. I mean, she could have chosen an easier way of quitting, but for her, it was not an option. So she lives by that failure is not an option. And the other thing is that she is a go-getter. You can hear from her story. She sets her mind to something, she goes for it, no matter what, okay? So, and I think the other important part is that I have already mentioned that
Yes,
she has really inspired. We all went the path of College of Medicine, which was not, was ahead of us. And we managed to look at her and also not give up on our own selves. So she has really been an inspiration to us. And I think to many young doctors, you know, we have a big story to learn from her, about her. She mentioned integrity. Zanele through and through, she's got integrity. She is just somebody that you can go to, and she will always advise, not because you are the friend, but she will be honest about it, and with the highest integrity about issues. So the one thing though that is a positive and a negative, the fact that she is a perfectionist. It is good that she is a perfectionist, but on the other hand, I think when it comes to family, she needs to tone down a little bit, because, you know, we need to allow kids to be who they are. Yes, you want to bring the best out of them, but when you are too much of a perfectionist as a parent, then it may be a disadvantage to your children. So, but otherwise, she's an amazing human being. She epitomizes a lot of things. She epitomizes hope, ambition, inner strength, and resilience. So yes, the sky is the limit for her, and she is a really phenomenal woman.
Yeah. So I did not make a mistake by inviting her here today.
No, definitely not. Learn a lot of things from her.
Yes, no, man. You know, I mean, I got a glimpse of her story when she sent me the, you know, obviously, I mean, she's my Facebook friend, I must also say that. But I got a glimpse of her story, and I thought, no, man, I want to invite her. You know, initially, I don't think she was sure whether she wants to agree to it or not. But later on, she actually said, you know what, I want to do this thing. I want my story to go out there. People mustn't just look at the finished product that I am now. People must actually know that behind this finished product that they see is a lot of challenges, a lot of hurdles that I had to go through. And for another, you know, a human being would have given up many times before, you know. But I told myself, Uguti, this is my dream. It will happen, noma kanjani, you know. And so for me, I think the biggest thing, besides just showcasing one of the few Black anesthesiologists, is also to say, when you have a dream that continues to burn you, you must stay with it. Do whatever that's in your power. You will eventually get to where you want to be. And she is a living example of that. You know, whether ubuya emakhaya, eVasbank, you know, where mhlambe ibhasi ihamba kayi-1 in a day, you know, but that does not determine how far you go in life. And she has just demonstrated that for everybody else. You know, I mean, 42% of South Africans are actually still in rural South Africa. All right, 42% in rural South Africa. And many of them, they experience what she experienced during those days. She was still a dandy. So we need to have people like her, you know, who don't come from, you know, okay, she was privileged in the rural area, but still it was rural environment. So we need to showcase people like her, you know, somebody who is actually comfortable enough to say, hey, being shy English, you know, I can speak it well. And because there's this thing that if somebody cannot speak English, you then think that they are stupid. So being able to speak English is not you know, something that shows who you are, you know, intelligent. You know, mastering the language, the Queen's language, is not equal to IQ level yomuntu. You know, and so for me, I was happy that she was sharing those things. You know, so that people can actually say, you know what, I know that my brain works very, very well. I might not have a good command of a foreign language, you know, because it was a second language or third language for me. But determination and nayo, you know, the hard work and everything else will still pull me through. And so for me, I think that's the big, big message that I take from his story, Sika Dr. Zanele. Nimbizani, need to Mazet or Nimbizani? What's the nickname that you use for her?
We use a number of them. I call her Za or Mgani.
Hey.
She's Mganwam. We call him Mganwam.
Yeah,
Or Za
so,
is another name.
Yeah. All right. So, Doc, can you unmute yourself, Dr. Zanele? We are wrapping up now. Right.
Okay.
Dr. Zanele, now Mganwam, so you've listened to her talking, telling us about you. Hey, so what do you want to say to her now? I mean, she has put 2 hours of her time to go further.
Umngani wami is exactly like me. Oh, we've been through a lot together. Because I'm sure he's told the story, which is we are at Sebokeng Hospital. That's where we met.
Yeah.
And coming here, trying to get the post, and she is married, having children, the hardships, having sick relatives. Our story is similar. So I know she is as strong as I am, but I can't believe she managed to do that, being a married woman with a husband sick at some point, and she became a dermatologist at the end. I'm so proud of her.
Yeah.
I'm so proud of. She's still down to earth, her humility, hardworking, and she's one of those people. We were actually talking yesterday that we feel that we're not doing enough to motivate and inspire. We're thinking we need to maybe, because we are a group of, okay, I've got many friends. I'm blessed with friends, very good friends. But the group from Sebokeng, we are a group of 6 specialists. She's a dermatologist. What happened? Dr. Maggie is an ophthalmologist.
Yeah.
Another one is a pathologist. Dr. Coupe is a gynae. So we're like, we can have even a medical center and work together, or we could organize seminars for GPs. I mean, in one house, you have all these specialists. We're thinking we're just sitting in our corner. I mean, specializing exhausts you. By the time you're done, you are finished. I can't imagine anything harder than that. You know, medicine I was doing, initially I was getting distinctions and things like that. Before I got to a level where I got distinction, like when I was doing primaries and things like that, you know, you study to a point where you like, can I do this? So after doing all of that, you are exhausted. You're exhausted. But I think I've had a break. That is why last year I went back to Steve Biko and I was doing some critical care, because at least I have, even though I qualified in 2011, but my training ended up in 2009. Then I was working at the capacity of a specialist already at Tambo Memorial. So I think, so most of my friends finished in the past 3 to 5 years. So they're still recuperating. I think at some point we need to work on that.
There's something there's something that you mentioned, Dr. Z, and you wrote it on your bio as well. And I was like, okay, why is she writing this thing? She mentioned that she's single with 2 kids, 12 and 19, right? And then she also wrote never married. I was like, okay, why are you so never married? It's like an emphasis. So I want to know, Dr. Bunolo, she's saying you were married. Well, you are married, not you were. You are married, yet you managed to achieve wara. So this thing about marriage and
I'm not understanding. You want to know if I'm never married?
There seems to be an issue around, like you
No.
emphasize. No. You emphasize that I was never married. That's what you put. I want to know, where did that come from?
No,
Another person was going to keep quiet, you know.
I wanted to explain that I am single not because I'm widowed or something. Not that I have anything against marriage.
Oh, okay. All right. Okay. So you are single but still looking.
No, I'm seeing someone.
Okay. Okay. Lovely. But these kids, 12 and 19, both boys or boys or both
girls.
Girls.
They're girls, yes.
Yes, and at least I'm sure now you do make time, for them. Unlike when a reg.
Yes, no, well, like the beauty of being an anesthesiologist is the in as much as actually becoming one, getting there is quite an effort. It's tough. It's you really have to put, like I didn't even know how to socialize after that, because for 5 years you can't even, you only attend your your mother's funeral. Everybody else, your immediate family's funeral, you can't attend nothing, you can't go out for anything, because there was a time when I used to sleep for only 3 hours in order for me to be able to study, because you start at 7. You start at 7, you do a list that can finish at 5, and then after that you have a tutorial. Say you based it at Charlotte Matlai. So you finish your work maybe at 4, 5, then you drive to Bara for a tutorial, then will be 2 hours. You finish around 7. You must still drive back to Joburg Jan to see patients. That will take another hour to 2 hours. So by the time you're done for the day, it's 9 p.m.
Yeah.
Then you need to go home. At home, see children, see that they've done the homework and study, because the amount of studying that you need to put in, sure, it was too much. So definitely qualifying and getting to a point where I am, it gives you the advantage that you can decide in terms of work hours. You can choose the list that you want. And also when it comes to income, you can choose. If you want to make a lot of money, you can make a lot of money. But if you wanted to choose to have more time with your kids, comfortable hours, so it allows you that flexibility. You can also work for the government. When you're working for a government, you just a consultant monitoring what they're doing. Basically, you sit in your office and then you go to theater. So they present patients to you, tell you, these are the patients coming to theater, these are the problems we anticipate, you discuss with them, then you pop into theater just to see that they're doing things fine. So it's nice.
Yeah.
So you can do an 8 to 4 with the government, because even the calls, remember doctors are, when you're working for the government, you're forced to do the calls. But as a consultant, even now I'm doing sessions. So as a consultant, you do your calls on the phone. So they call me with, so I run ICU. I'm running the ICU at Tambo Memorial and theater. So when I'm on call, when they're looking for ICU beds, they call me. So then I make the decision. If maybe there's 3 people looking for 1 bed, then I make that decision. Which patient is more qualifying for the bed, and also to advise them how to manage the patient in ICU. Then on weekends, I go there and do a 1 hour, 2 hour, or however long it takes me, but maximum 2 hours ward round, then I'm done. Versus if I wasn't a specialist, then I'll be expected to sleep in the hospital, and so it gives me that flexibility.
Yeah. Thank you.
Yes.
Now, then I think, is there anything else that you'd like to share, with the people who've been tuning in before we wrap up?
I think I've said a lot of things, because I just wanted to share the main points was, I wanted to mention them. It's important to have role models. For every step in my life, I had a role model. So initially, in terms of hard work, work ethic, integrity, honesty, it was my parents.
Yeah.
And then as I go further, then I started wanting to emulate my sister, the one that went to Sis Jablile, Mrs. Kumalo. So I wanted to emulate her. She was this pretty woman who was cooking at home, doing all the right things. She went to university. So I wanted to be exactly like her. And then at some point, I had a cousin, Jabu Hadebe. She is the one who triggered this thing in me wanting academic excellence, because she was going to school and she was skipping. She went to Samgela and they were making her skip classes. She was very, very clever. So I wanted to be like her. I think she started a lot of who I became in the end, because she showed me that it can be done. So I focused on, even though I didn't know exactly where I'll end up, but it was wanting excellence. I think, yes, wanting to emulate people who are excellent in whatever they're doing. That's what drove me, because even as a medical officer, I'm like, no, man, I can't have patients that died that could possibly have lived if somebody else did it. And I was like, if I'm doing something, I have to be the best in what I'm doing. So I said, the only way I'll carry on with this anesthesia is if when I'm a specialist.
Yeah. Yes.
And for the same reason, and being an anesthetic consultant, your duties is also to look after ICU. Yeah. So I have been looking after ICU on a sessional base since 2012. But there's always this thing in me that I'm doing this job. I'm sure I'm doing it well enough, but it's not the best because I don't have critical care. Hence, I went to Steve Biko to do so. My story is unfinished. Yeah. I still need to finish the critical care, and also I feel like I have a lot to contribute to the community. I think I haven't even started doing that. I'm honoring a lot of people. I even have a doctor that I met. Two people I met recently. The one was telling me she wants to do a diploma in anesthetics, and I just spoke to her briefly. The next thing, she got a diploma, and she's saying I'm the reason she got it. Like, I have that influence on people. Like, I don't know what I do or say, but somehow when people
inspire them, you inspire them.
Yes, I do. So I feel like more people need to have access to whatever it is that I do or whatever that I say. Yes. So I'm looking into going to bigger platform, to maybe going to schools. I don't know, some form of reaching more young ones to motivate them.
Lovely.
And also, in South Africa, the way things are happening, it's like the only way to make it either to be a celebrity or to be a tenderpreneur. And education, I feel like, is being discouraged. Yeah. So I also want to be that person that is reminding people that you can still follow this route. It's sustainable. At this point in time, even during lockdown, we were working. At any point in time, you are working. You are your job is, you have job security wherever you are in the country. Whatever is happening in the country, you have that job security, and you can go beyond security. Yes, that's the message that I want to pass.
The last point from me: how did COVID, affect your work, positive or negative, especially with the ICUs and stuff? Did it put more load on you, as the top dog, you didn't really have to be there all the time.
So there were different phases. Initially, I even thought I'm not a frontliner because initially, actually we locked down because I'm mainly doing anesthetic. I'm an anesthesiologist, so I do procedures. So we were we couldn't work because all elective surgery was stopped. So the first few months, I wasn't really affected, except when I was on call at the government, where at some point you find out of 6, only 1 is negative. All the other patients are positive. So that was my first exposure to COVID. And then when we went to level 4 or 5, 5, 4, 3.
Yeah.
When we went to 3 and they opened up, my goodness. It was so bad. Anesthetist, there was 1 week where 4 anesthetists died in 1 week. The 1 week, 2 of my close friends, one died. Dr. Chibwe died Friday morning. And another doctor, Dr. Taye, died Saturday morning. That weekend, I couldn't work. I refused work. I was so frightened. And that week, I don't know how many doctors died. They're just falling off. They're just falling and falling like flies. It was terrible. That peak, when we reached the peak, I know we felt it. We felt it. I felt pain like I've never felt in my entire life. Because when your colleague, when your friend dies, they bring death close to you. You see yourself dying, and especially now when they're doing exactly what you're doing. But thank God, up to this point, I've been safe. I've never been infected. But to all the colleagues that passed away and all the families that are left behind, deepest condolences. But it was tough. And then when it comes to the financial part of it, we are still under. We haven't recovered. We haven't. People that work for the government are sorted, but us who are self-employed, and now it's end of August, it's tax. It's VAT, it's everything. So it's still terrible. But you know what? When you look at the big pictures, people lost lives. Yeah. What is money? So that's how I look at it. But yes, it affected us significantly. Actually, the companies that do billing for doctors, they said most of us are earning 20 to 30% of our normal income.
Yeah.
That's how bad it is.
Yeah. It's gonna pass, and like you've been able to go through other things in the past, even this one will pass.
Yes.
All right. Let me thank Dr. Bunolo for joining us and listening to us. Doc Bunolo.
Hi, Doc.
Yeah, I just want to thank you, man, for joining us and helping me to fill in the gap at the time when there were technical challenges with Dr. Zanele.
It's my pleasure. For her, I'll do it anytime.
I know.
Going, and also go and inspire the young ones coming up. We need more of you guys. Please don't emigrate with your top skills to Canada or Australia or New Zealand or UK. South Africa needs you guys. All right. Thank you very much. I really enjoyed talking to you, Dr. Zanele. And you'll be getting your clip in the next 5-10 minutes. YouTube clip, which you can then share with so that those who cannot log in, if they are able to follow our discussion. So thank you very much. Thank you, Dr. Bunolo. Thank you to all our viewers enough to follow this conversation. Until next time.
Thank you for having me.